Hello, everyone. Just waiting for a few people to come in and for my special guest to join me today. My name is Brendan. I work at Whitman-Walker. And hi, Lisa. And today we're going to be talking about what it's like to get the COVID-19 vaccine. I think a lot of people have heard about it. A lot of people know it's out there, but not a lot of people have heard experiences from people who've gotten it. So Marshun is going to be coming on with me, and here he go. Hey,
Hi,
Marshun.
Brendan.
How you doing today?
I'm doing well. How are you?
I'm good. It's Friday, although it was a very short week, so it's like double nice because I have a lot of energy, and it's also Friday. So
But you have like triple the amount of work to make up, so it's like, okay,
because we still work a full week.
we definitely still work a full week, period.
Um,
I can pin the comment too because I have it. Oh wait, I don't think it. There we go.
That'd be dope. Yeah, Marshawn. I mean, we're gonna be talking about the vaccine today, but Marshawn's just pinning how we also at Whitman-Walker have free
Well,
HIV.
I think you have to do it.
Yeah, I'll do it. Pin comment.
Yeah.
Yeah, because we still have free HIV STI testing by appointment, and we still have COVID-19 testing if you want to send an email. We'd be happy to have you. So,
Period.
um, maybe we'll just wait one more minute for other people to come. But thank you so much for joining us today. We're all really excited to have you here.
It's like I've never been here before.
It's like, oh,
It's like this is so new to me. Like, what is an Instagram live
what is
for Whitman Walker?
what?
Yes, Paula. Paula has stepped into the room.
Martin's got his favorites.
Yes, and I'm calling you out today. I'm calling y'all out. Um, but I guess we can go ahead and get started. Hi everyone. It's the Women Walker Live OG, Marshun from Community Health. My pronouns are he and she. Like I said, I work here in community health as a community outreach specialist, prep navigator, phlebotomist, counselor, everything you need.
Look at all these
Um,
wearing. You're just doing everything here.
so many heads. And we are joined today by the infamous Brendan, and I'll allow him to introduce himself.
My name is Brendan. I, like Marshawn, work at Whitman-Walker in the community health department. I wear a few hats too. I'm doing a lot of HIV testing these days, but I've been calling a lot of people for the COVID-19 vaccine, doing outreach.
Yes.
Super psyched to talk about our topic today. My pronouns are he, him. Um, I don't think I need to tell you guys who are watching that COVID-19 is raging across the country. As of today, January 22nd, coronavirus has infected, I think, 24 million people in the country. It's killed just over 400,000. And also, I think just over 12 million Americans have received the vaccine at this point, or received the first dose of the COVID-19 vaccine, which is going to be really key to getting rid of COVID-19.
Right. And like Brendan said, Americans are slowly getting the COVID-19 vaccine, which is 95% effective at preventing against acquiring the coronavirus. Certain groups are getting the virus. I'm sorry, certain groups are getting the vaccine before others based on getting COVID-19 and developing severe COVID-19 symptoms. Of the 4 to 5% of Americans who have received the vaccine, most are primarily healthcare workers and some are individuals over the age of 65.
Yeah, I mean, we understand there's a lot of uncertainty and mistrust around the vaccine. I totally get it. These vaccines have been developed in record-breaking time, and medical institutions have not always treated the American public very well, particularly certain groups like Black Americans.
Absolutely. But we're here to tell you that the vaccine works and it's safe. Take it from us. Brendan and I got the vaccine.
Yeah. Marshawn and I are both considered healthcare workers in our capacity at Whitman-Walker because we see clients and patients at the HIV STI clinic. So we were eligible to get the vaccine pretty soon after it was made available to certain DC residents. So we're going to use this live to talk about our experience getting the vaccine, kind of in the hopes that our conversation today is going to encourage you to ask questions and feel more comfortable about getting the vaccine yourself.
Right. And just like a quick note slash sidebar, everything that we talk about is just our own personal experiences. We do understand that your family members might have a different experience, or your friends, or even, like your favorite celebrities, of course, might have a different experience. And you may as well. And that's, totally normal. This whole vaccine rollout is literally the most complicated project that the United States government has undertaken, literally. So it's not surprise, it's no surprise that there's like a variety of vaccination experiences because, all of our stories look different.
Yeah. So I think let's just start from the very beginning. Marshun, even before you got the vaccine, what did you think of the COVID-19 vaccine before you knew you were going to get it?
Okay, so you want the real tea.
Yeah.
Okay. So, Brendan, I'm gonna always keep it real. I'm gonna be honest. I remember like those moments of consideration. Those nights where you're just like in your bed, those sleepless nights where you're kind of like in your thoughts, and your thoughts won't allow you to go to sleep. Yep, that was definitely me. My mom was questioning whether, one, if the vaccine was effective than other vaccines, how many vaccines there will be, how the vaccines will work in people who have like a greater chance of contracting severe illnesses. How long will immunity last? My mom was just like wondering everywhere. But yes, Brendan, I had a lot of moments where I had to step back and really think about it. And of course, getting on Google and stuff like that just makes you just like overthink everything. But all of the above, period. Brendan, what did you think about the COVID vaccine when you first found out, before you got it?
So I have been following the news really closely. Just I honestly feel like there's not a lot to do in quarantine. And so
Right.
for the past few months, I've just been reading the New York Times, vaccine hits this stage of development, here's how it's coming. And then when the data was actually published, I was like, damn, this is really good. I was really impressed with what was coming out of Pfizer and Moderna. At the same time, I was reading reports that, the CDC guidelines might have been interfered by political preferences. I knew from my science background, the vaccine was super important, but I was really worried that I don't want any politics to be involved in the development or in influencing what vaccine. So I was mostly on board. I was slightly skeptical. But I think in the end, when it came time, to get the vaccine, I ultimately trusted scientists, the independent FDA panel. I just put a lot of trust into the institutions that we have.
Okay. So let's move on to when we were actually getting the vaccine.
Yeah.
Because I know we all think about it, but where's the action? So Brendan, how did you find out that you were eligible, and how did you sign up for the vaccine? What did their process look like? Because I've heard so many different stories.
Yeah. So Pfizer Moderna vaccines, I think they were approved in the middle of December. And I knew that as a healthcare worker, I would get some sort of preference to go before others, but the timing, no one ever said anything about the timing. I thought it would be January, February, March, but could have been January 1st, could have been March 31st, and I had no idea. I had some friends who were healthcare workers get it in December, and so I was like, okay, that's really cool. And I was in Massachusetts at the time, so I was hearing their Massachusetts experiences. And then I think it was December 27th, 28th, I got an email from Whitman-Walker's occupational health team, and they were like, go ahead, go forth, sign up. And they sent the link. And I was like, oh, wow, that happened really fast.
Yeah.
There wasn't a lot of warning. It was just boom, go for it. And I was checking my email, and I was like, okay. So I went to the DC Health Portal. It's an online website. And I just kind of answered a few questions about why I was eligible. I'm a healthcare worker. And then I was directed to a map of DC. And they were like, okay, here on this map are all the different places in the city that are giving out COVID vaccines. Pick one. And so I picked the one that was closest to me. It was like a Safeway. And then there was actually like a problem with the website where like I kept trying to say like I want this time, and they would say like no vaccines are available.
No vaccines were available. Yes.
Yeah. So I was really confused, and then I just picked a different place. I went to Bread for the City, which is like a cool nonprofit, and like it worked out. And I verified my appointment. I got an email that said like your appointment's been verified, and it like had the QR code. And yeah, so I had my appointment January 4th at 2 p.m. That was my long experience. Marshun, I know there's some overlap because we both work at Whitman-Walker, but like what was your experience like getting to know that you got the vaccine, like in signing up for it online?
Yeah, so my story is definitely similar with signing up for the portal and clicking appointment times and it saying no vaccinations available. And so I was like, why would you have this time up there? So definitely felt you on there. It was so frustrating. But anywho, like you said, both vaccines were approved in December. Therefore, I had a few weeks to really think about it. And my brother's a neurosurgeon in New York. So he actually received his vaccine 2 weeks before, maybe like 2.5 weeks before I actually got mine. So I was able to get some feedback from like a trusted source, of course. And then I gained the courage, knowledge, and understanding from there to just click the DC Health Link website and attempt to sign up. Brendan, I actually signed up like 4 times using different emails. It kept knocking me out until one morning after like troubleshooting for like 30 minutes. It allowed me to book like a same day appointment. And so I never received a confirmation email. And oh my God, this is my story. I don't suggest anyone doing this either. I didn't get a confirmation email or time, and I forgot. I'm like, I don't remember what time or which Safeway I was supposed to go to. So I just went to any Safeway in DC. I just picked a random one on my maps. I went there. The lady was like, we don't have you on the schedule. We're no longer doing testing at this moment. So I ended up going to another one. I Ubered there after calling them, and she was like, you don't have a QR code with the confirmation email. So I ended up literally, Brendan, registering for the 5th time at the Safeway in that moment, and it somehow sent me the email.
Oh my goodness.
Yeah, so mine was a little
chaotic.
interesting. Yeah, so I don't suggest anyone just popping up at a Safeway, but definitely go to the website and register and make sure you have your confirmation email. I was not gonna be defeated, Brendan. Like I promise you I wasn't. I was like, I built up this much courage to get it. I cannot go home without this vaccine.
And I think that just speaks to like how kind of chaotic the rollout has been. Like you're not the
Yes.
first I've heard. Like I had problems trying to find an appointment. You had like a very unique situation where you were like literally driving around different Safeways. Like I've heard shit like that. Like it's pretty.
Yes. It was a lot. Yeah. But luckily I got my shot.
So you might have mentioned this, like you signed up, you were ready to go, and you went to like Safeways. Like what was it like getting to the vaccine place, checking in, like what, like can you talk a little bit more about that?
So Safeway, and it was interesting. Like I said, I felt like I was literally on an adventure. But when I got there, no one was in line. I walked to the first window, completed like the registration paperwork, dropped it off at the second window, and I waited around for my QR code to come. It magically came out of nowhere. She scanned it. I went into the exam room, and that was it. Where did you go for your appointment, and what was it like for you?
So I went to Bread for the City, which is a nonprofit, like kind of like in Shaw, Logan Circle area. And I got there. My appointment was at 2 p.m. I got there at 1:30, so like a little bit early. And there was a line outside of the facility, like people waiting. And there was a guy taking my name. He was like, "Hey, like, what time are you? What's your name?" And he like checked me off. And then I got in the building like right at 2. They like let my cohort go in. And we went to like a waiting area. And the receptionist was calling us all up and having us fill out the consent forms, and like then I just kind of sat for like 20 minutes in the waiting area, and then person administering the vaccine called me and was like, okay, like, come on back. We're doing it now.
Okay. That seems like it was kind of smooth.
It was very smooth, like, especially
Okay.
considering how I've, like, heard other experiences.
Yeah.
Yeah.
Okay. So let's actually talk about getting the vaccine. So, Brendan, how did it go getting your shot for your first dose?
It went really well for me. It was super smooth. Like, medical provider called me back. The provider was a fourth year med student at GW. She was
Mm-hmm.
super warm and kind, and like asked me a bunch of questions about my medical history, went over like everything about the vaccine, like answered any questions that I had. Like, she was really kind. The shot itself was really painless. Like, I'm usually fine with needles, but like I truly didn't even feel it going in my body. Like, I was like, oh, that was really, really easy. And I got the Moderna vaccine. They don't tell you which one you get before you go. So I just like found out right there. I was like, okay, cool, Moderna. Yeah. And after I got my vaccine, I waited in the waiting room for like 15 minutes. They were like, we just want to supervise you to make sure there's no like big reaction. And then when my 15 minutes were up, I got to go. And like, I just went home, like had a sandwich. I left the building. I think it was like 2:45. So the whole thing took only like an hour. It was like relatively easy.
Oh, wow.
How
That's
that?
interesting.
How was it?
Um, oh, okay. So I got the Moderna as well, the Moderna vaccine. And I found out I was getting it when I got there as well. But overall, I rate my experience definitely probably like a 10 out of 10. The provider was very knowledgeable, confident, and honest. She didn't make me feel like I had any concerns, and if I had any questions, she was open to answer all of my questions. She gave me a brief rundown of the process. My overall visit only took maybe like 20 minutes tops, and that's including the 15 minutes I had to wait afterwards. And there was a wine cellar in this place, so I just walked around the wine cellar, and before I knew it, my cart was filled with wine, and my 15 minutes was up.
Oh,
Um,
you had a
yeah,
much
and
15 minutes than I.
y yes, and I'm a phlebotomist as well, and I hate needles. Like I have a phobia of needles, and I didn't feel it at all. I was like, give me a countdown. She didn't even give me a countdown. By the time we started talking about other stuff, I had got my shot. She had put my band-aid on it, and she had wrote my next appointment date on my card, and it was over with.
That's super
That
smooth.
was literally it. It was so smooth and fast. I was like, I didn't even feel it. Like I didn't feel it inserting. I didn't feel the needle inside my arm. I didn't feel the vaccine. I didn't feel anything. Nah, the flu shot, definitely feel that.
Yeah, totally
Definitely
agree.
feel that.
And you
Hmm.
got some wine out of it. So like, honestly, great.
Literally, like I couldn't have had a better experience.
No. Okay, so you got the vaccine. Did you experience any like side effects after you got it?
So yes, the only side effect I experienced was just like soreness around my arms, so just like muscle pain. But I just literally just massaged it, and that was it. It didn't hit me until the next morning. So like when you first wake up and you feel that pain, it's like, oh my God, where did this come from? That was definitely my arm, and me, but it only lasted, Brendan, for maybe like 4 days. 4 days. I'll definitely say, yeah, maybe like 4 days. My muscle was sore, but other than that, I didn't have any, like headache, nausea, anything.
Okay, that's
What
actually.
about you?
I did have some side effects. They were like super mild.
Mm-hmm.
Definitely like you. I like I first noticed it. I went to sleep that night, and I think I guess I tossed and turned in my sleep, and so I like tried to roll over onto the side where I got my vaccine, and I woke up in the middle of the night like, ow, like I that really hurt. So for a few nights I would sleep on my right side because I got it on my left arm, and like I had to
Mm-hmm.
train myself to
Same.
do that. But it was only like 4 days and 4 nights. Like it wasn't huge and like went away. And
Mm-hmm.
then I also like so I got it on the 4th of January. I would say on the 5th, like maybe like 24 hours after, I started to get like kind of a headache. Like I felt a little bit warm and like tired. And so I just like kind of laid down. I had a really simple dinner that night, and I went to bed at like 8, and I woke up the next morning, and I was like, totally. So I would say they were like super mild, like not a at all.
So how long did your soreness last? Can you hear me? I think is it my service? I'm on. I don't know. Can you hear me, Brendan? Oh, sorry, difficulties. Maybe someone's calling.
Hey guys, I think Marshun's or my Wi-Fi cut out, so we were not able to finish the live just like a second ago, but we're back on, and Marshun is going to come on in just a second. Thank you so much for bearing with us. We have like one or two final things to talk about, and like just kind of like tell you how we're feeling about our second shot, how we're feeling about the rest of the process. Ready? Hello, Marshun.
Yes. Hi, Brendan. We are back.
We're back. I don't know what happened, but
Undefeated.
technical
Um,
difficulties.
yeah, I think you were just wrapping up your experience, and I was asking you maybe how long your symptoms were lasting in your with your sore arm.
So my symptoms did not last super long at all. They were like just 24 hours or so, and they were super mild too. So it like
Okay.
was pretty fine.
Are you connected to the Wi-Fi there?
Yeah, I am.
I don't know why it's so delayed, laggy.
Unconnect. If you think that would be, what'd you say?
Maybe, maybe unconnect. Hmm. Yikes.
Okay, I just disconnected from the Wi-Fi. I wonder if that's gonna make it better.
You said what?
I just disconnected from the Wi-Fi. So,
Yes, this is better.
okay, cool. Um, so I think you and I are in the waiting period for the last shot. How are you feeling about the second vaccine?
I feel pretty good about it. I don't have any concerns. I have heard people say that getting their second dose, you kind of feel it a little bit more. But other than that, I have like no negative thoughts or concerns about it. I mean, I went and got the first one, so I might as well continue and get the full thing.
Yeah, good.
What about you?
I know. So yeah, I know that the second shot usually like you get a stronger response.
Hmm.
I like had a few side effects at first, so I was kind of like, okay, like I think I might get more side effects for the second, but like it's not like I'm not going to take it, you know? Like I definitely like will take it. I'm signed up. Like it was nice that they signed me up at Bread for the City for a second dose on
Right.
February 1st. So like And then after I do that, I'm going to be 95% protected against COVID. So I'm really excited for that.
Period.
Yeah.
Yes, I literally feel like a superhero.
And I also will note that even when I get my second shot, I am still going to wear my mask. I'm still going to social distance. I will still be doing you there,
I
Marshun?
it was kind of breaking up a little. It was kind
That's
of breaking up a little bit, yeah.
yeah, that's cool. I was just saying I'm still gonna wear a mask and social distance and stuff.
Yes, absolutely. Just because we're getting vaccinated, we are still gonna wear our masks. We're still gonna wash our hands. We're still gonna be safe. We're still gonna distance ourselves from others. Um, okay. Yeah, I guess that's pretty much it, Brendan.
Yeah, I don't see any questions in the comments. You can definitely drop them right now if you have them, but I'll just say a few reminders.
Yes.
Whitman-Walker is open for free HIV and STI testing by appointment at our Liz location in Northwest and at our MRC location in Southeast. To make an appointment, you can call, and I'll put the number in the chat right now, 202-39.
Yes, and social distancing is a way to reduce the amount of COVID-19 community transmission. It increases the physical space between people to avoid spreading the illness, especially around the holidays, you guys, where many people are used to traveling. Please make sure that you guys are staying at least 6 feet away from other people when possible, wearing a mask in public, avoiding places with large crowds, encouraging work from home if possible, speaking with loved ones over the phone, on FaceTime, Skype, video chat, Duo instead of in person. Social distancing is actually caring for your community, FYI. Stay up to date on local, state, and national guidelines for testing, quarantine, and general safety. Please remember to wash your hands for at least 20 seconds at a time and stay at home if you don't feel well.
And if you want to stay up to date with Whitman-Walker, follow us on Twitter, Facebook, and Instagram at Whitman-Walker and at RealTalkDC_. Just stay up on all things Whitman-Walker. Thank you so much for tuning in, and it was so great to talk to you, Marshun. Always love doing this with you.
Yes, and for anyone who's needing any HIV STI appointments, you can give us a call at 202-797-4439. And if you need a COVID-19 appointment for testing, you can call us at 202-745-7000, or you can email us at appointments, that's plural with an S, at whitmanwalker.org. And I hope you have a wonderful weekend, Brendan. Of course, I love doing my Instagram lives with you. And I will talk to you later.
Talk to you later. Happy weekend.